So Dr. LeRoith, we've talked about type 2 diabetes, what causes it, and who's predisposed to it, and some of the factors that contribute to it. Tell us a bit about the diagnosis and also the symptoms. Like if someone suspects they might have diabetes, if they have a family history of it, if they're concerned, what should they be looking out for in their symptoms, and what would be the process of actually getting the diagnosis? How do they do that?
That's an excellent question because it's quite complicated. One of the issues we have is that type 2 diabetes can be silent for many years. Mm-hmm. And so when you have obese individuals and they develop type 2 diabetes, they may have no symptoms for 5, sometimes 10 years. Mm. And sometimes the first indication that they have diabetes is that they come to hospital with a heart attack, or they have neuropathy, their nerves give them problems. And so one of the ideas for the physicians and for the patients is if you have a strong family history of diabetes, you should be screened often. Mm-hmm. And the physician should screen you for diabetes. There's a second problem, is that what's commonly used is a fasting blood sugar. Where you come see the physician, you come to the office, and they take your blood in the fasting state. And this has become tradition over 25 years. Unfortunately, this is not that helpful because often the first thing to go wrong is the blood sugar after the meal. So your fasting sugar is what's happening overnight. When you have breakfast, it then depends on your insulin whether you can keep your blood sugar normal. And as I said, the insulin problem is what first shows up. And so if we could get patients and physicians to check their fasting glucose, that's good, but do another glucose after the meal. Because then we detect their type 2 diabetes much earlier, and they wouldn't have a 5-year history of where they're being told by the physician your blood sugar is normal. So that's one test that they could do. There's another test which measures blood glucose over 3 months. It's called Hemoglobin A1C. And this will tell you if your blood sugar's been up over the period of 3 months. They're now normative data, and if individuals have their hemoglobin A1C a little elevated, we call that pre-diabetes. We say that's, with time, they're going to develop diabetes. On the other hand, if it's elevated above the normal range, then of course they have diabetes. So those are patients who don't have symptoms. Then there are the individuals who I said come with a complication because they've had early diabetes for 10 years without knowing about it. And then of course type 2 diabetics can also develop the symptoms of thirst and excessive urination. They don't usually show a loss of weight because they're the obese type 2 phenotype.
Very interesting. So it sounds like what you're saying is that diagnosing type 2 diabetes depends on the right blood test at the right time. And you mentioned that the standard for many years was to do this fasting blood sugar, but we're finding that's not really the most sensitive test, that it's more sensitive to test the blood sugar after the meal, because that's when we'd see that insulin resistance making the person unable to control their insulin levels.
Correct.
Very interesting.
And there's another aspect that a lot of patients have high blood pressure, have high lipid abnormalities, such as triglycerides and the HDL cholesterol. These abnormalities give us a clue that the individual has what we call the metabolic syndrome.
Right.
And that happens before you develop diabetes. So individuals with hypertension or abnormal lipids and a family history of diabetes, those individuals physicians should be more careful about screening them at any age, because type 2 diabetes can start in childhood and it can start in adulthood.
Very interesting. So you mentioned this other blood test, which was the hemoglobin, the glycosylated hemoglobin,
right.
Hemoglobin A1C. Is that considered really a screening test? So if someone's concerned, if they have an uncle and a parent and a grandfather who had diabetes, if they get that test and it's normal, they're okay? Or how do they think about that?
It's actually more convenient than doing the blood sugars that I mentioned.
Sure.
Because it gives you an indication of how your blood sugar has been over 3 months.
Right.
And we now have normative data, both the American Diabetes Association, European Association for Diabetes, now have normative data that you can say this individual does not have diabetes, or this individual is prone to diabetes in the near future, or this individual has diabetes if it's above a certain level.
Very interesting. Thank you, Dr. LeRoith, about this discussion of how to diagnose type 2 diabetes. What would you tell our home viewers about the importance of actually finding the disease early versus finding it late? Is there a difference in outcome? If someone's sitting there at home and they think they might have diabetes, what should really motivate them to go to the doctor and get a blood test and get it checked out and deal with all of this stuff?
It's very clear today, and has been for a long time, that type 2 diabetes leads to complications. The initial complications with type 1 are more the eyes, kidney, etc. With type 2 disease, it's much more the large vessel, which means stroke and heart attacks. Eventually, both can overlap, and type 1s can develop the large vessel, and type 2s also develop the small vessel. But if you're interested in preventing yourself having a stroke or a heart attack because you have type 2 diabetes, A, the diagnosis is important, and B, the treatment's important. It's clearly shown that we can prevent them or reduce their impact if we treat the patient adequately.